Hi, my name is Sarah Haig, and I'm a doctor of physical therapy at Entropy Physiotherapy and Wellness in Chicago, Illinois. I'd like to take a couple minutes today to talk about pelvic pain. Obviously, if something in your pelvis begins to hurt, it can become quite distressing. Some people can ignore it. Some people, it just goes away. Other people need to seek help. Once you've decided to seek help for your pelvic pain, there's going to be no shortage of people with opinions, thoughts, suggestions, things that you should be doing in order to get better. The question becomes, what should you believe and how do you decide what to do? I'd like to offer a couple of guidelines just so that you can navigate the healthcare field and all the information that's out there to have more success. Number one is that getting better does not have to hurt. Some physicians, some physical therapists, even some patients who are having pelvic pain are under the misconception that it has to hurt in order to heal. This is just false. You should not have to hurt more to hurt less. Number two, whenever you go to a doctor visit or physical therapy visit, you should be leaving there feeling hopeful, hopefully with less pain, but also knowing what the plan is going to be. If you find yourself leaving your visits on a regular basis, feeling more confused, more frightened, or in more pain, it's time to discuss the plan of care with your current providers or to seek new healthcare providers. Number three, your life does not have to be on hold. One of the things we actually know that it applies to all pain is that doing things you enjoy and moving help. A lot of times I've had people come to me and they've been told that they had to stop doing all of the things that they love. And this is untrue. It is my job, or the job of your physical therapist, to help you find a way to continue doing the things you love or to modify them in a way so that you can do them safely and be confident that you're not making yourself worse. Number four, feel free to Google, but do so with caution. So a lot of times when you go to a doctor or a physical therapist, we give you a diagnosis. A lot of patients would like nothing more than to know exactly what is wrong with them. However, it's not usually that simple. And then what starts to happen is you Google words that end up frightening or end up giving you misinformation. So Google, but consider the source. Consider looking at hospital websites, physical therapy clinic websites, and then discuss it with your doctor or your healthcare providers, your concerns, your confusions, and the questions you may have about what conditions you have. Finally, you should be getting better. Many people with pelvic pain end up undergoing many procedures, diagnostic tests, and various treatments with physical therapists. I encourage you to challenge your physical therapist to do better. You should feel better in 4 visits. You should not be feeling worse, and you should see some consistent improvement over the course of the first 4 visits. And then you have unlimited potential to improve after that. But please, if you feel like you're getting worse or not going anywhere, discuss the plan, and if the plan isn't going to change, you may need to change your provider. The whole purpose of this little chat was to have you know that there are lots of options out there for help, and there is lots of hope. So if you are feeling frustrated with your pelvic care, there are lots of wonderful therapists in the world, and we would be happy to help you connect with them. So you can look us up at www.entropy-physio.com, or you can email me at sarah@entropy-physio.com. Thank you.